Hi, I'm Dr. Bill Townsend from Canyon, Texas, and I recently had the privilege of speaking at the American Academy of Optometry 2014 in Denver. One of the lectures I did was Good Drugs, Bad Reactions, and I became interested in this topic just through the years by seeing some of the things that happened to my patients from the drugs that I gave them or other medications that were prescribed to other doctors that either had an effect on them directly or had an effect on their vision. So my lecture fell into really two big categories. The first category was medications that we prescribe, even eye drops. What impact can they have on a person's general health? An example would be anticholinergics like atropine. In children especially, because they're smaller, if we put a drop in their eyes of something really powerful like comatropine, 5%, about 20% of that, anywhere from 20% actually to 40% of that drop ends up going through their nasolacrimal system. And the nasolacrimal system absorbs medications very quickly. So these children can become drowsy, they can become disoriented, they can become sleepy. In some cases, it can actually affect their breathing. So there's two messages there. One, we want to keep powerful anticholinergics that we use in our office all away from any place where a child could open a bottle and drink them. And we want to be careful about the way we administer these drops. Maybe occlude their puncta for a few seconds after we instill the drops, because we know they have potential side effects. They can even do that in adults, but children are much more susceptible. There are a number of other medications I'm not going to take the time to talk about, but there are many medications that are drops that we instill that can have a systemic effect. The second area that we talked about in this lecture is some of the systemic medications either that we prescribe or that other doctors prescribe that can have serious impact on the visual system. One that everybody's talked about a lot is ethambutol. Ethambutol can actually cause neuropathy that can affect vision very negatively. Another powerful medication that we know about it, but we tend not to necessarily keep track of it, is Plaquenil. Plaquenil is prescribed for people with autoimmune diseases like lupus or rheumatoid arthritis. It's a very effective medication, but the problem with this drug is in some individuals it can accumulate in pigmented cells, specifically the retinal pigment epithelium, and over time it can actually cause reduced vision. So it's very important that we monitor that. For years we've monitored it using fundus photography, and that's a very good method. But we recently have come to realize that we can do even more successful monitoring with using the OCT and looking actually at the RPE to see if it's becoming thinner and degenerating over time. So those are just a couple of examples of the lecture that I delivered at the Academy. I look forward to hopefully seeing some of you again at the Academy in 2015. And thanks for the opportunity to talk to you a little bit about my lecture.